I'm Dr. Chip Cole. I'm a quadruple board certified oculofacial plastic surgeon, which specializes in eyes and face. And I'm going to talk to you about a facial yoga video that talks about 4 exercises for malar bags and festoons. I'm going to break down each of these 4 exercises and let you know if they actually work. But first, what are malar bags and festoons? Well, there is an area on our cheekbone, the prominence is called the malar region, M-A-L-A-R. And so most people use malar bags and festoons as something very similar. Technically, there are 2 ligaments in this area. One is called an orbital malar ligament. The next one is a zygomatic cutaneous ligament. And in that little triangle comma-shaped area is where you build up fluid, and that's called a festoon. That is caused by those ligaments having laxity, and some are predisposed to that genetically. You even see children sometimes that have a small festoon. It's something that I specialize in and I repair. I am sent people from all over the world to repair their festoons. And to do that, I have to go behind the eyelid. Sometimes I sneak under the mouth so there's no scar involved. And I can repair that area permanently. I find it very interesting that exercises might be able to help. So let's take a look and see if these really do help festoons. Please make sure to subscribe. So when we look at this first exercise called lymphatic drainage, it's a technique to help to drain fluid from the face and especially the lower lid, malar and festoon area. The most important thing is to go from the nose area out toward the ear, because your festoons are located here. The upper lid is not as important, but you want to go from right around the nose this way so that it goes down the lymphatic channels. You don't want to be out here at the festoon malar area and go this way, because you're actually pushing fluid through. So the upper lid is not as critical because where the action is right here. And it's an excellent technique to get rid of some swelling, and we use it post-operatively all the time. But the thing I want you to realize is, if you're watching her exercises, is she's ending up going from the outer area where the festoon is and pushing the fluid in, because it should go in this direction. So if you're going to make a full circle, just to make it easy, you want to go this way. You don't want to go this way. So we see on this second exercise, which is a 3-finger pulse technique that she does, it could certainly be much more effective if we follow the lymphatic channels. What she's doing is giving this pulsing on the muscle and the lymphatics, which is good, but what would be much more effective is to do it outward toward the lymphatics. So if we start inside and do the pulsing, we're kind of milking that fluid out to the lymphatics, because if you don't get it out of that region and draining into the lymphatic system, it's ultimately not going to show much improvement. So if we look at this third exercise, first of all, I love the name, Flirty Eyes. We see that she is holding pressure at the area where there's swelling. And that's good for movement of the fluid, but you have to move. If you just hold it there, it's not going to be as effective. Now the flirty eye part is fun and it's funny, but it's not moving the fluid out. What we want to do is, once we have it, is we want to turn our fingers and push it out into the lymphatic channel that goes down here. So what she's attempting to accomplish with the mouth movement is she's trying to make the cheeks go in by making that movement, and then she's fluttering the eyes. What is more effective is to smile and get that tissue up, then put your fingers there, then rotate it out. The flirty eyes is fun. I think you should do it because it's cute and it's enjoyable, but it's not effective. And if we look at this last exercise, the fourth exercise, the mini V or V, what is interesting about it is the V is at a higher position. The reason the V gets deeper, as she says, is because you're including the corrugator muscles at the brow. The mini V is at the tendon, kind of like where a hammock connects to a tree. So both of them hold a muscle insertion point, and it is the muscle that drains the lymphatic tissue. So by holding the V in place, by moving your eyes and doing that half flutter, that's not going to be as effective as if you let your hands come down and then milk it to the side. And if you milk it to the side, the lymphatic channels go in the front of the ear, not behind the ear. So you notice also in the closing of that exercise, she's going behind the ear when it should go in front of the ear, because that's where the lymphatic channels are, as you can see in this anatomy diagram. So you've seen these exercises and hopefully you'll get a little improvement, but I don't think you're going to get much improvement. So if you want more improvement than you're getting from the lymphatic massage, I do a technique called an inside-out lift that gets rid of malar edema and festoons. And it's completely scarless as far as no incisions on your face. I use an endoscopic approach where I make one small incision in the temple on each side. I've kind of tunneled down with an endoscope, which is like a big straw with a camera on it. I also kind of sneak under the lip to the area where the festoon is, and I loosen those ligaments so that we can reset them. So the first thing I do, I call it the 3 R's when I'm teaching people. The first R is for release of the ligaments. The second R is to recontour that area. And then I reset, that's the last R, where I'm fixating the tissues. When the cheek that has fallen with gravity, when the ligaments get loosened and it's raised up, it will bunch a little here if you also don't contour the brow. So by coming in this area and this area, I basically will recontour, reset the cheek, as well as the temporal brow, and it puts all the tissue back where it used to be. And in cases of people that have it as a congenital onset, it gives improvement over what it was, because I'm resetting those ligaments to a higher position. You can think of it very similar to if you had a hammock that was stretched out and the hammock's fine, if you can tighten it and reset it, you essentially have a new hammock. That's what we're talking about. So when these tissues start to fall and the ligaments stretch, all the yoga in the world is not going to reset and tighten and put those tissues where they need to be. So if you want a permanent, natural looking procedure to repair that, then come see me. I'm in Atlanta, Georgia, and I would love to help you out.